Hi there, I'm Susie Cohen, America's Pharmacist, and a lot of you know me as the author of some natural health books. I've been a pharmacist for almost 30 years, but I really prefer natural medicine and natural alternatives. So today I thought I would spend a little bit of time with you and share some natural solutions to help you if you've been suffering with some joint pain or some tendon or ligament issues. And also, if you can wait a few minutes, I will tell you how to get a copy of my newest ebook, The 9 Best Foods for Arthritis, as well as a supplement that I created called Joint Script. And I'll tell you a little bit about that as we move along. But right now, I wanted to share with you just a little bit about some arthritis because millions of American adults have it. Probably 1 in 4 adults have it. And this graphic just shows you about the chondrocytes, which are cartilage cells, and the little red points on the body there show where it can occur. It's absolutely painful for some people because it can become degenerative, and for other people it's just mild creakiness. And I don't know where you're at as you watch this, but just basically I think we can all relate to how it feels when we try something. We try diet and maybe exercise. We try all these things and yet it still hurts. And so this graphic shows you where you might be experiencing some pain. Perhaps for you it's your lower back, or your shoulder, or your knees. A lot of people have knee trouble. And again, nothing they try helps, even physical devices and braces and chiropractic, and some people have to resort to surgery. But for the most part, most people will take a medication called an NSAID, which is short for non-steroidal anti-inflammatory drugs. Now, these drugs are quite popular. You probably know them as ibuprofen or aspirin. Indomethacin is another, diclofenac. There's a bunch. In fact, they're separated by their category too. But the point of this slide is to just show you some of the side effects that could occur. Hopefully this hasn't happened to you, but for a lot of people this is quite popular. Problems with allergies and heartburn and reflux in particular, esophagitis, those are the big ones. You'll see the warnings on these medications that you have to take them with food in order to try to curb some of the GI side effects. Some of them also can raise your blood pressure and raise your risk of cardiac problems. And if you're old enough, you probably remember the Vioxx debacle. So that was rather unfortunate. A lot of people don't know why they get ringing in the ears, but that's a very common side effect with non-steroidals. And there's also something else. Your methylation pathway could get crushed. And by that I mean your ability to create and absorb folate, the natural form of folic acid. Folic acid is synthetic, but folate is natural, and that's what your body makes, that's what your body craves, and that's what you need for adequate methylation. But NSAIDs deplete B9 or folate, and not only NSAIDs, but all of those drugs on my slide. So you can see there's just that, those are the categories. So there's probably over 100 medications that are what I call drug muggers for folic acid, or that's how most people know it, but it's actually technically folate or methylfolate. Diabetes medications are a big one that deplete this, but again, NSAIDs, which are used in the treatment of all kinds of joint-related disorders. So today I'd like to help you get back to doing what you love, whether that's gardening or tennis or yoga or just being able to button your shirt or bend over and paint your toenails or tie your sneakers. I totally get it. The way we avoid long-term disability is by doing a few different things. So this graphic I spent about an hour making because I wanted you to understand that you want more cushion, more cartilage. You want your body to be able to build bone. Remember those chondrocytes that I showed you? Those are cartilage cells. You want that too. You want collagen, and specifically collagen type 2, and hyaluronic acid, which acts like a sponge. You want more of that. And PGC1 alpha, I added that at the very end because that's sort of a life extension switch in your body. And so if you can get more of those things, then you'll feel better. You'll feel great if you can also simultaneously lower the inflammatory cascade, which would look like reducing prostaglandins, tumor necrosis factor alpha, interleukin-17, another bad boy called CXCL12, and the matrix metalloproteins, or MMPs, especially 1 and 13. You want to get rid of those, lower those, because those MMPs are degrading your type 2 collagen, which is what you need for healthy joints, tendons, ligaments, and cartilage. So doing all of these things will help you feel better. And so there are some natural ingredients and alternative types of remedies that I recommend. One of them is frankincense. This is centuries old. Everybody knows frankincense by its other name called boswellia, but this is a beautiful golden resin. It comes from the sap of the Boswellia serrata tree, and you'll see it labeled in products as boswellia. They don't normally label it as frankincense. I just call it that because I like its natural name. But this very popular anti-inflammatory actually reduces a pathway called 5-LOX. It neutralizes that. It suppresses some of the inflammatory inflammatory compounds that are spawned by 5-LOX. So it's a 5-LOX inhibitor. And I could have listed that on the prior slide, and I probably should have, but I was in a hurry to make this because I wanted to get this to you as soon as possible. The truth is, another day in your skin might be intolerable, and so the sooner I can get things done, the happier. So anyway, reducing the cytokines that are spawned by 5-LOX is very important. Curcumin is well researched. Who hasn't heard of turmeric spice? Turmeric is amazing, and from that we get curcumin. But what you may not understand is that there are actually 3 biologically active ingredients in curcumin. It's not just one, i.e. curcumin, it's 3. So there's curcumin, there's 𝒍𝒆𝒈𝒔, and there's 𝒍𝒆𝒈𝒔. You try to say that's a mouthful. But anyway, those 3 ingredients that come from curcumin root, or specifically turmeric, that's what really works. And there is this patented form of curcumin that has all 3 in them, and it's termed C3 curcumin. And you can find C3 curcumin, again, it's a trademark patented ingredient, and consider the gold standard in our research. Now, this delivers those 3 curcuminoids that I tried to pronounce but unsuccessfully a minute ago. I don't know how that happened. I mean, I am a pharmacist, so I'm pretty good at pronouncing multisyllabic drugs and compounds, but anyway, forgive me. So C3 curcumin has been studied extensively. I mean, when you see a curcumin study, they have probably used C3, and they've actually used this to show that it can suppress progression of some cancer cells, specifically by reducing NF-kappa B expression. Another profound ability is that this product can inhibit the COX enzyme, which is what Celebrex can do, and Celebrex is actually a prescription drug. So to see a natural agent like C3 curcumin ability to reduce the COX enzyme, and that's kind of amazing. Collagen, with a K, is a trademark patented form of collagen that is type 2, which is specifically what your joints are hungry for. So you have to back up a little bit. Collagen is one of the most ubiquitous compounds in your body. It is the most abundant protein in your body. Collagen is also what keeps you looking youthful and pretty, but it's a different type of collagen for your skin, right? That would be collagen type 1 and type 3. Where it pertains to your cartilage and your joints and all of the areas that you think of when you think of arthritis, you have to think about collagen type 2. And that's what this collagen with a K is patented for, because it is specifically type 2, which is highly effective in helping with all kinds of joint related problems, like think of stiffness. And also when you think of collagen, you have to think of elasticity. So taking something like this could be very useful in turning back time. And it was studied, as you can see, I cited a study here from the International Journal of Clinical Pharmacology Research, where they found that it helped to reduce all kinds of body aches and joint swelling in people with RA. So RA, rheumatoid arthritis, is an autoimmune driven form of arthritis, which is a little different than osteoarthritis. But either form of arthritis should respond to some of the things that I'm talking about today. Of course, with that, I have to, please ask you to speak to your doctor about what's right for you, because I couldn't possibly know what is right for you. But whether you have RA or osteoarthritis shouldn't really matter. Some of these things could be very helpful. Now, this methylsulfonomethane, or MSM, is just a sulfur-containing compound. We actually have MSM in our body, and I've included it in my joint script because I think it's a very natural way of improving the body's sulfur, not to be confused with sulfa with an A. Sulfa is a drug that a lot of people are allergic to, but sulfur is natural to the body, and we all have it as human beings, and it's profound in terms of its ability to help us detoxify and also to support our joints and synovial fluid and our cartilage and everything that goes along with joints. That Potem Hot Springs on the right, that picture, that is from a few years ago, and they are permanently closed. But I included a picture of that because that was a hot spring that had a ton of sulfur, and you can smell it. Unfortunately, it smells a little bit odd, not good, kind of like rotten eggs. That's how you know that something has sulfur in it. And if you've ever been to a hot spring, you know what I'm talking about. Now, hyaluronic acid is like a sponge. You want more of that. Your body makes this. It's just that it goes down. You can think of it as WD-40 because it's lubricant for your joints. And if you're not getting enough relief from your medication or from a supplement that you're taking, you could always bring in a little bit more hyaluronic acid. Ginger root, super famous for people who have nausea. Pregnant gals with nausea will chew on a little ginger candy. It's usually crystallized with some sugar on it. You can also have ginger tea. They make supplements of ginger as well. So ginger root, you can buy this at any produce section and grate a little bit in some water and mix it with honey or lemon and have this wonderful tea. But the reason that ginger works so well is because it's reducing some of the pathways that I mentioned earlier. It's reducing levels of tumor necrosis factor alpha. It's also a 5-LOX inhibitor, and it's a COX-2 inhibitor. Ginger targets a bacteria called 𝒃𝒊𝒊𝒏𝒅, so it's great for people who have heartburn and ulcers. And just FYI, I found this little snippet I thought was pretty interesting. 𝒃𝒊𝒊𝒏𝒅, the gut bug that's associated with ulcers, is also associated with the pathogenesis of arthritis. Hard to imagine, but ginger goes a long way in curbing all of that. It can even be useful for people who are undergoing chemotherapy and have chemotherapy-induced nausea and vomiting, and it's a safe, natural remedy for that. So, the benefits of having natural remedies on board and taking some of these herbs and things that I've talked about is that there's fewer side effects than medication. None of these come with the risk of a heart attack. None of these can really provoke an ulcer unless you take them above dosages, and I don't think any of you would do that. But what you see are profound benefits from head to toe. So you'll see the support of cartilage, faster muscle recovery if you're working out. You'll see better health for your ligaments and your tendons, improved flexibility. It's kind of like yoga in a pill. That's how I think of it when I think of a joint script, and I formulated the supplement, so I'm really proud of it. It's patent pending, and it's incredible. And I just got these sample bottles, so there's 14 capsules in them, and if you take 1 per day, that will last you 14 days, but most people take 2 per day, and that is the recommended dosage. So if you were to take 2 capsules per day, this is a picture right here of the ingredients that you'd be getting. You'd be getting some of the things I've talked about, as well as some other. I didn't mention the selenium, but selenium is there. Selenium helps your body to make glutathione, and having glutathione as an antioxidant can help reduce the inflammatory cytokines and reduce that cascade of pain-causing chemicals. So that is why the selenium's in there. Plus, it's an excellent immune supportive mineral. And Joint Script does have that C3 curcumin that I mentioned earlier. So this is the suggested use if you'd like to try it. And in a moment, I'm just going to tell you how you can get it. But right now, I just want to show you your options. First of all, you can start out with 2 capsules every day. Just take it with a snack or a meal. You don't have to. I just do that because herbs generally, you think of them like plant medicine. You would want to take them with a meal. Just eases any kind of tummy upset that might happen if you're really, really sensitive. But you don't have to. If you take Joint Script on an empty stomach, then you might get a little bit higher effects of the anti-inflammatory components in it. But most people, I would say 90% of people who have used this product and given it a 5-star review have taken it with a snack or a meal. And they just take 2 capsules every day in the morning, like with breakfast or maybe with lunch. You could also separate that if you wanted to. You could take 1 capsule in the morning and 1 at night. Like around dinner time. So you could do that. You could also just start out and see if 1 is enough for you. I just take 1 per day, and I do a ton of yoga and Zumba, and I feel great. I just take 1 per day, and sometimes I'll take 2 if I, hurt myself or hurt my ankle or something trying to get into down dog and hold it for 10 minutes. Who wants to do that anyway? Hover is the worst. I can hold hover for about 1.5 minutes and then I collapse on my face. But anyway, if you overdo it at the gym or doing yard work or, whatever your favorite activity is, then just take 2 capsules at that point if you feel the need. And then for chronic, for those of you who are suffering every day, I would recommend 2 capsules every day with a snack or meal. And here's how you get your free bottle. Just go to this website here noted on the screen. It's suzycohen.com/free-joint-script. And if you don't have a computer where you feel comfortable doing that, I know you're watching this or somebody's showing it to you, you can also call our customer support line, 800-979-1405, and you'll get this free bottle. There is shipping. I think it's like $5 or $6. That helps me cuddle the package and wrap it up, get it from my fulfillment warehouse to your door. But there's no charge for the Joint Script. It's normally a $12.99 value, and I think once you try it, you'll absolutely love it, and then you'll want the big bottle. And that's my hope. You'll also get a free ebook with this offer, and that is to help you determine what to put in your kitchen cupboard and what to put on your plate in order to help yourself get well faster. Of course, do consider physical therapy and also massage and chiropractic. Stay on your medication if your doctor has told you to do so. Everything I've said today is just an idea. I don't possibly know what's right for all of you, and I have to say it, but the FDA has not evaluated a single word that I have said to you. They monitor health bloggers pretty closely. So I hope you've enjoyed this presentation, and I hope you get what I'm trying to say. I'm trying to help you, and I hope you'll try my Joint Script today. Have a great day. I'll see you next time.